Hello everybody, wanted to make a video on concussions and the new topic of chronic traumatic encephalopathy, CTE. It's actually not a new concept. This is something that we've known about for 100 years, and so it's become mainstream, and we're deep into the NFL season, deep into the football season, and so we're seeing more and more concussions. We're seeing new rule changes, and we're seeing some changes to the game, and I wanted to make just a video on just my thoughts about some of the changes and some of the real risks to the game of playing contact sports. This includes American football, rugby, hockey, mixed martial arts, boxing. And so what we're finding with chronic traumatic encephalopathy, which is a progressive brain degenerative condition that accumulates or develops in your body rather, from repetitive cranial injuries. And so when we play football and when we play contact sports, there's continuous and residual trauma to the body, not just the body, but the head itself. And what happens is, with all of these injuries to the cranium, to the brain, they accumulate injuries. And if we consider the different levels of the body, so you have your skull on the outside, and then your brain is basically just floating in water. And when you have a concussion, your brain ricochets back and forth in between, within the skull itself. And doing that hundreds and hundreds of times, the brain becomes bruised. There's chronic inflammation, chronic swelling, fluid accumulation. There's certainly pain. There's one of the reasons is that there's only so much room within your skull, and so as the brain begins to swell up, that's where we begin to feel certain pains. And so, as we begin to autopsy NFL brains, we're finding this condition at alarming rates. And so the most recent study out of the University of Boston, we found from 111 former NFL players, 110 were diagnosed with this disease. And this disease, what happens is, so again, the levels of the body. So currently the CTE does not show up on an MRI. It doesn't show up on a CT or an X-ray scan because the damages done to the brain are at the nerve level. And so if we look at the nerve of your cells, you have what's called your microtubules, and they give structure to your cells and your nerves. So it gives the form of your nerve. And what happens is there's what's called tau proteins, which that surround these microtubules. And from the impact, when you have a concussion, your brain rapidly stretches and contracts. And this is a rapid stretching of the brain tissue and your nerves as well. And so this rapid stretching and coming back together destabilizes your nerve cells. And so what happens is these proteins begin to be released in the surrounding injury sites. And these protein sites are acidic, they're toxic, and they begin to actually eat away at brain tissue. And the problem is, from hundreds of impacts, depending on your position, they've calculated up to 1,000 impacts from a single NFL season. And so, but that's a single season. And so that's 14 to 15 weeks of regular season. You have preseason, you have preseason games, you have preseason mini camps, you have fall camps. And so the problem with NFL football players is they're constantly getting hit in the head. And so that is the problem. It's not necessarily a problem of a single concussion. It's hundreds and hundreds of impacts to the head. And there's a study done by the University of Pittsburgh that actually said that 5 out of 10 concussions go undiagnosed. And so you don't have to show signs of confusion or pain or dizziness or anything like that to actually have a concussion. And so it's a very tricky thing to diagnose and understand because we can't see into the body, and that's one of the main things that we're finding out as we begin to autopsy these brains. Is we're finding that the depth of the problem, and it's progressive. And so as we go forward into this era, and more that we know about the problem, we'll begin to see people develop dementia, Parkinson's disease. Just like former boxers, this condition used to be called dementia pugilistica, which was seen in boxers, and they get resting tremors and Parkinson's disease. Same thing with will develop in football players. And so CTE like I said, was confirmed in 110 out of 111 cases. This was also found in multiple college athletes. This was also found in high school athletes. So it's not a matter of age. It's a matter of cause and effect. If you're getting hit in the head continuously, you're going to begin to develop this degenerative disease. And so that is the true risks of the game of football, of the game of contact sports. And what I'm beginning to study, this is something that I went through myself. I was a college football player, and I had dozens and dozens of concussions. At the time, I didn't quite understand what was going on. I didn't understand what was happening to me. But over the course of my experience, I experienced headaches, dizziness, vertigo, vomit, deep depression, just many things, many symptoms, and ultimately it came down to my ability to find ways to help restore my body. And so the problem with Western medicine, which is largely based on pharmaceutical intervention as well as surgical, maybe PT, chiro if you stretch it, but pharmaceuticals, they don't restore injury sites. And so if we look at Chinese medicine and traditional Chinese medicine, which is one of the main things that I study now, they're all about body restoration. How can we restore injury sites? And the problem with CTE is this is a result of chronic bruising, chronic scar tissue that's forming specifically on the brain itself. And so if we look at ways that traditional Chinese medicine can begin to help and assist this problem, it's all about restoration of your body and your mind itself. Because if as your nerve endings lose the ability to communicate with themselves and the rest of your body, these long-term psychological symptoms actually begin to manifest. And so my big take on this problem is, if you want to continue to play these games, you have to be proactive in the treatment and the restoration of your body. And so my treatment protocol consists of 5 things. Acupuncture, which is seen to help promote blood circulation into the brain, wherever you put the acupuncture needles, but it helps to regulate cerebral blood flow. And so if you have stuck blood or microbleeding or tissue damage, improving the blood circulation to these areas can help to promote healing of the brain tissue. I'm a big proponent of craniosacral therapy, which further helps to promote blood circulation, cerebral spinal fluid up into the head, but it also helps to prevent lymph circulation. So your lymphatic system helps to clear out any dead tissues that you have in the rest of your body. It runs right alongside your circulatory system. And so as we have dead cells, your body's lymphatic system helps to clear all of that out. And so craniosacral helps to, like I said, it helps to promote blood circulation up into your cranium by doing subtle pumping mechanisms of your skull and also of your pelvis itself, because that's what helps to pump fluid up your spine. Number 3 would be diet and supplementation. If we can internally digest anti-inflammatory supplements, anti-inflammatory foods, we can help to prevent some of the long-term swelling and inflammation. And I'm a big proponent of breathing and meditation. So like I said, with the craniosacral therapy, there is a constant fluid pumping up and down your spine, and that's actually powered by your breath. Your diaphragm and your pelvis there's a fanning mechanism in your pelvis, and your diaphragm itself helps to pump fluid up into your spine and your brain. And so if we can incorporate deep breathing exercises, it ultimately helps to bring new nourishment up into injury sites in your brain. Because the brain is a difficult place to get to because it's encased in your skull. And so if you can use deep breathing to help promote this healing. And then obviously meditation is such a powerful thing as well. There's a Harvard study done that suggests that there's a new concept called brain nerve plasticity. And so over time, at one point we thought that once a nerve is damaged, it's damaged for good, and we can't fix it. And so with meditation, we've actually seen nerve endings begin to actually reestablish connections and reestablish new growth. And so, like I said, if you want to continue to play these games, you have to be proactive. It's not a problem of a single concussion. These players are getting hit hundreds and hundreds and hundreds, sometimes thousands of times, depending on your position. And if you do that year after year after year, this disease begins to form as a result of chronic and residual injury accumulations, and that is the problem. And so with CTE, it is a new phenomenon as from a sports perspective, and we have new technology and new scans to begin to understand the problem. We are beginning to, like I said, clarify and diagnose this condition, but the treatment strategy for how do we fix the problem, that is ultimately my one of my endeavors in my career. And so there's a million high school football players. There's 50,000 college athletes. There's maybe 5,000 NFL players. So millions of people every year are enduring some of these injuries. And so ultimately, it's with things like these treatment strategies, we can help to prevent some of the possibly prevent some of the long-term effects. There's still studies that need to be done, but like I said, we've observed with traumatic brain injuries, specifically with acupuncture, helping to promote and regulate blood circulation up into the head. And so these are some of my thoughts from a medical standpoint, and then. This is a real condition. A lot of people disregard this, the science that's uncovered, that's beginning to emerge in clinical trials and clinical research. But we can't try to shut science out. This is a real problem. Regardless of how much we love the game of football, we're putting these players and kids into harm's way willingly, really in the realm of entertainment. And so, like I said, if we can begin to address this problem, and it's not a helmet issue, it's essential to understand that it's not a helmet issue. It's the game itself. It's part of the game itself is to endure these impacts to your body and head. And it's the reason it's not a helmet issue is because your brain is just floating in your skull. And so you can have the best helmet, it protects the outside of your skull, but upon impact, like I said earlier, your brain is just ricocheting back and forth within your skull, and ultimately we have to get in the same way that we would treat any other injury. We have to try to treat the brain itself from chronic bruising, chronic inflammation, and ultimately help to prevent some of the chronic and progressive degeneration of the brain itself. And so these are some of my thoughts. My name is Tony Megna. I'm a licensed acupuncturist in the state of Wisconsin, and I'm completing my doctorate studies, actually in-depth studying this exact problem that we're talking about right now. So email me with any questions, and would be happy to talk to anybody that is experiencing some of these problems. So thank you for listening.